and the access that I have as a member of Congress and that my staff has to solve individual problems. And whether it is interceding with a senior who has a Medicare issue, or whether it's helping a veteran get the medals that they earned, in some cases 70, 80 years ago, but for some reason never got, or whether it's helping a veteran who retired or left the service with a particular disability rating and really believes that he or she deserves a higher one. That's what we do. We do it every day, and we do it very well. And I think it's the most honorable work that a member of Congress can do, because what government really is about is, or at least what it ought to be about, is serving the individual needs and interests of the people. And as a member of Congress, my job is to be responsive to your individual needs and concerns, and I think I've done that. I have priorities for this area. One of my priorities is to protect the programs that senior citizens find so important, and there are three. One is Social Security, as you all know. One is Medicare, as you all know. Pardon me, and a third is Medicaid. Now, often people don't think of Medicaid as a senior program, but roughly 60% of what we spend on Medicaid provides for nursing home care, long-term care for seniors. So it's hugely important. And roughly 65% of the money that nursing home operators take in on an annual basis is Medicaid. So we have to be very careful about that. And one of the things I always worry about is, because one of the buzzwords you hear in Washington is entitlement reform. We've got to have entitlement reform. Well, guess what the entitlements are? The entitlements are Social Security, Medicare, and Medicaid. So when people talk about entitlement reform, listen very, very carefully, because what they're talking about is you. And they're talking about programs that you have come to rely upon, and programs that are very, very important to your health and your welfare and your financial stability. So I too look forward to the debate tonight. I thank you for coming, and look forward to your questions. Thank you. You know what, I think I'm going to just pass on a rebuttal, and fine with me if we go right to questions. Lee, is that right?
In the front, yes.
Make my work hard, just a minute.
When I went to my ophthalmologist last week, he told me that his wife has some kind of a terrible disease, and it cost him $11,000 a year just to pay for his insurance, plus $11,000 a month just to pay for her medication, plus $6,000 a month to pay for a different education. And I didn't pay too much attention to it until I saw on 60 Minutes on Sunday the exact program that spoke about this huge amount of money that people have to pay for health care. So what is this? Well, what is the solution to this?
Okay, that's a tough question to answer in a minute. Healthcare costs are escalating, although the rate at which they're escalating is lower now than it has been in decades. The cost by which Medicare is increasing per capita is about 1.5%. That's the lowest it's been in decades. And Medicaid cost per capita is flat. The challenge that we have a couple challenges. One is we have access now to treatments and procedures that didn't exist even as recently as 2 or 3 years ago. Those treatments and procedures, and particularly pharmaceuticals, are very, very expensive. Another challenge we have, and this is something that the Affordable Care Act is trying to do, is move healthcare delivery and payment in this country from a volume-based service, that is to say, a physician bills for each service that he or she provides, and turn it into a value-based service, where outcomes are part of what determines how much the physician is reimbursed or the hospital is reimbursed. And we're turning that battleship. It's a long struggle, but we're turning that battleship, and if we're successful in doing that, then we will be successful in at least curbing the rate of healthcare costs.
Well, the The incumbent and I have a respectful disagreement on Obamacare. I'm someone who believes that Obamacare has resulted in higher premiums, higher deductibles, lost doctors, canceled policies, longer wait times, hospitals gaining monopolies and then creating their own insurance company. I believe that we need to repeal Obamacare. We can improve our nation's health care. But there are certain components like allowing people with pre-existing conditions to be able to get coverage is good. Allowing children to stay on their parents' policies is good. We need to allow small businesses to be able to pool their policies, to be able to cover their employees, to allow the portability of policies across state lines. A lot of people who are on Medicaid, it would be great for them to be able to go out and get the right policy for their family, and they would be in a position where they can go to work. A lot of people on Medicaid are not going to work because they're afraid of losing Medicaid. I think that we can also utilize our tax code to allow folks who are struggling to make ends meet to be able to afford to go out and purchase the right policy. I also think we need to have medical malpractice reform. The medical malpractice rates on Long Island are really high. So if you're an OBGYN and you're paying $230,000 a year in malpractice rates, you may reduce your scope of service or even move out of the state altogether. So that's another concern as well. So I think that there needs to be a substantive discussion between Republicans and Democrats, between Congress and the White House to improve health care because the costs are becoming cost prohibitive for a lot of seniors.
Other question?
Yes. Wait a minute.
Mr. Zeldin especially, you've been very reasonable in bringing up some legitimate things. And yet, the question is, your literature has gone out, and it's like, oh my God, I want to go to bed, pull the blanket over my head, because the incumbent is selling us out on national defense. Do you stand behind mailings like that? We also have I stand by, I don't even know exactly which mail piece you're referring to, but if it came from our campaign, I would always stand by it. The incumbent and I have a disagreement on certain issues related to national defense. We have a different opinion with regards to the threat of ISIS. We have slightly different opinions related to border security. We agree on, we've been talking, I guess we have similar opinions with regards to the threat of Ebola and the need to stop travel. We disagree on whether or not we should close Guantanamo Bay. For me personally, I'm concerned about the Bergdahl prisoner exchange where we have a Marine in Mexico right now who's in prison, yet we, to get to Sergeant Bergdahl back from Afghanistan, we let 5 very high-profile terrorists leave Gitmo. So, first off, to answer your question, whatever you received, I stand by, and I believe that that certain threats are very important. And I think the one you're looking at had something to do with Guantanamo Bay. We disagree on that one.
I believe the mailing you're referring to is one that says that I have made New York unsafe because I support releasing terrorists. Nothing could be further from the truth. But here's the issue. The issue is there was an amendment offered to a bill that prohibited the use of funds to transfer, not release, to transfer anyone out of Guantanamo. Here are the facts. And by the way, I voted against that amendment because I think we should be able to transfer people out of Guantanamo. We spend $2.7 million per prisoner in Guantanamo. We spend $490 million a year to keep Guantanamo Bay open for 166 prisoners, half of whom, by the way, have been recommended for release by the Defense Department's detainee release board. It costs us $34,000 a year to house someone in a high security, maximum security federal penitentiary. There are 6 penitentiaries that are administered by the Department of Defense that are at 48% occupancy. So what I'm suggesting is that they go to one of those 6 facilities that are at less than maximum occupancy, and I don't think any one of us wants to take the position that we don't think the Department of Defense can detain terrorists.
I read in today's Times that the Department of Defense intends to spend umpteen millions of dollars celebrating the glorious participation in the Vietnamese conflict. Do you have an opinion on that?
I don't know the story you're referring to, but I will say this. I think if the celebration is focused on those who waged that war, I would support it. And I'll tell you why. I think a stain on our history, and this is my generation, it was the people my age for whom that war was sort of the war of our generation. We did not welcome those men and women home with anything approaching the grace and the courtesy and the support that they deserved. And so if what you're referring to, and as I said, I did not read the article, but if what you're referring to is some way of recognizing their service and celebrating them and finally welcoming them home in an appropriate way, I would support it.
I too, I'm not familiar with the story specifically. It sounds like from the way you asked the question that the story refers to a very high cost related to the event. I think that it's, I'm sure that the idea is one that is filled with very important merit. I believe that we need to make sure that beyond just an outstretched hand and a hug to our veterans to say thank you for your service, that we make sure that they have the right health care that they need, they have a roof over their head, shoes on their feet. We have a disproportionate amount of veterans who are homeless. There are a lot of issues that allow us to say thank you in ways beyond just giving them an outstretched hand. With regards to the cost, which sounds like that was at the heart of your concern, I would need to know more in order to answer it.
Back here, you're next, Ferry.
I have a question for Mr. Zeldin. Aside from the fact that some of the literature from the Republicans has been, I think, not very honorable, I'd like to ask you the following question. You indicated you would like to repeal Obamacare because it's imperfect. Would you repeal the Constitution because it's imperfect and we have amendments? Would you perhaps consider making changes in Obamacare and keeping the things that are worthwhile rather than just getting rid of it? What is the purpose of getting rid of the whole thing when you can make amendments as we do with the Constitution?
Well, I do not support repealing our Constitution. I'm sure that there was a hint of sarcasm in there, but we take an oath. Sure. Can I get those 3 seconds back? I do think that, I take an oath. I take it very seriously. I've done it. I serve as a major in the Army Reserve currently. I'm in the New York State Senate currently. I take my oath very seriously. There have been times where we have amended our Constitution, which, you just have to take each individual proposal on its merits. With regards to Obamacare, as I mentioned earlier, there are components of Obamacare like covering people with pre-existing conditions, allowing children to stay on their parents' policies. These are a couple of examples of something that's in Obamacare that should stay. And there's other things that we need to do that can improve healthcare in this country, that can reduce costs, reduce premiums, reduce deductibles. There are many different proposals out there. I gave a few examples a little bit earlier. I don't necessarily want to repeat them, but there are a lot of things worth discussing. And I think that regardless of political affiliation, whether you're liberal, moderate, or conservative, my time is up. I think that we need to find a way to improve healthcare here in this country.
Thank you for the question. I think Obamacare is a work in progress. I think there are parts of it that are really, really good, and we should both keep them and make them better. And I think there are parts of it that need to be reformed. And I think that's exactly what we should do. And as I've said many times, I think any other mature legislative body would be about that business. We're 50 years into Medicare, and we're still reforming it. Because we believe the basic structure works. I think that's the case with the Affordable Care Act as well. And so I support the bill. I voted for it. If I had to do it over again, I'd vote for it. But I also recognize that there are things that require a fix. And by the way, most of the things that require a fix, everyone recognizes they require a fix. But we have a Congress, at least in the House of Representatives, the majority of which is fixated on repeal as opposed to reform. We should be dealing with reform, not repeal.
With regard to the health care problem, I don't understand why there are services like the fire department, the police department, other public services, where those departments don't make a profit. And why shouldn't healthcare also be a non-profit service? Currently, even with Obamacare, 18% of the money spent is a profit money and is not spent on taking care of the health problem. What's your feeling about that?
I'll start. I think what you're referring to is the profit that insurance companies make. And the law limits the profit that they make to 20 cents on, to 20, I'm sorry, not the profit. They require that 80% of fees or premiums that are paid go back out in the form of actual coverage of claims. The insurance companies are screaming. They say we can't possibly do that, et cetera, et cetera. Well, guess what? The cost of Medicare is 3 cents on the dollar. 97 cents of every dollar that Medicare spends is on the actual delivery of patient care. And so people say government can't do things well. People say turn it over to the private sector. They can do a lot better. Well, Medicare works pretty well, folks. 3 cents of every dollar we spend on Medicare is for overhead, whereas insurance companies, it's 20 cents of every dollar they spend. So there's, you know, I think that the insurance companies could learn a lot from how efficient Medicare is.
I think healthcare is a great example of something where you have not-for-profits and for-profits engaging in it with bad actors. I will, with Medicaid costs in New York State, 40% of our state budget is Medicaid. We have not-for-profits that carry $800 million surpluses from one year to the next. There are individuals who use the not-for-profit and for-profit laws, individuals, to make tens of millions of dollars a year off of Medicaid. So I think that, as far as the conversion to long-term managed care, you have companies that are, and not-for-profits, that are signing up people that they know are healthy and not reaching out to people who are in need of services, because there's a lower cost, a lower overhead. So my concern with regards to healthcare is that I can think of many examples of for-profits and not-for-profits that are bad actors taking advantage of the system.
If Congress were to consider...
Wait a minute. I'm slow.
Microphone.
I'm
It's
slow.
okay, I'm loud.
I'm sorry. I'm loud too, but you need a mic.
If Congress was to consider changing some part of our medical delivery system, would they consider the Part D Medicare not being able to negotiate drug prices? Because I think this is really a place where someone has their hand in our pocket.
Yep.
I think that there's a tremendous amount of money to save with regards to prescription medication for individuals, as far as just adding to the cost of living. You have to you might have to go out and fill a prescription with a copay. Rather than being able to get a 90-day supply, you may only be able to get 30.
I'm asking a specific question.
Well, I'm just saying that there's a lot of different ways to save money with regards to prescription costs.
I'm not talking about saving money, I'm talking about the requirement that we not negotiate medicine prices with the drug company. That's part of Part D.
Yeah, I'd be supportive of that.
You would.
I just,
care to elaborate, but to answer your question very briefly, I would support that.
Okay.
I support it. I'm a co-sponsor of a bill that would do that. And it's frankly, the section of Medicare Part D that doesn't allow negotiation was written by the pharmaceutical companies because they didn't want to have to negotiate. But the Department of Defense negotiates for better prices. Department of Veterans Affairs negotiates for better prices. It's not a reason in the world why the Department of Health and Human Services and CMS can't do the same thing. So I'm a passionate supporter of it. We should have done it long ago.
Right.
My question is for each of you. We've been talking about money for this, that, and the other thing, and I know that most members of Congress, whether they're in the Senate or the House, they have to spend so much time trying to raise funds. What is your attitude toward that problem?
Campaign finance reform.
I'll start. I think we definitely need campaign finance reform, and there are a couple of bills in Congress that I support that would move us to public financing of campaigns along the same way that New York City has a program, has a policy that if you accept small dollar donations up to a certain point, the city will match it. I think it's 4 for 1. But if you do that, you have to agree not to take large contributions from PACs and so on. I would support that. I think we spend entirely too much time, and actually it's not so much the time. I mean, we spend a lot of time. But what's really bad is the influence that money can have. And when I said, for example, a few moments ago that the pharmaceutical companies wrote that section of the law, they had the access because they had made the contributions. So I'm a firm believer in campaign finance reform, and I'm a firm believer in trying to take big money out of politics and let races be won and lost as opposed to bought and sold.
Well, with regards to campaign finance, one of the things that we did this year up in Albany is that we created a pilot program as part of the state comptroller's race. I think that as you look at the example of New York City, there are some examples of how the system has been taken advantage of, where individuals who are not in competitive races are spending a lot of money with regards to through the public finance system. The other thing, because there's a requirement with regards to straw men, there are individuals who have gotten in trouble because they might have one person give money to 7 other people, and then it gets reported from those 7 other people. So as far as transparency and accountability, the model is there. We're seeing right now how it's going to work in a state comptroller's race. I just think it's very important that any new system that you go to, that's not taken advantage of. Because I'm just concerned by some of the stuff that's happened in New York City.
Any more questions?
Yes, I was just curious whether either of you would be interested in supporting a bill that would change the 504 designation so that any money spent by a nonprofit organization, if it spends it on political action, even if it's 1%, has to report everyone that contributes to that charity so that we know who's really supporting all lot of organizations that produce these ridiculous ads we have to listen to.
Well, a lot of these entities would, they just create political entities. So, like the VFW, for example, actually I think they might have since gotten rid of it, but the VFW created the VFW PAC. So I would just be skeptical that if you change the 501c4 rules, that you're still going to have the individual donations being made. They would just end up creating a different 501c. They might create a 527. So it's just my concern is that it's easier said than done.
I absolutely think that the 501c4s need to have the same obligations that members of Congress have. We have to report where we got every dime, and we have every 3 months, and we need to report where we spent every dime every 3 months. And to call these 501c4s social service organizations is a mockery. I mean, what they are political organizations. They are taking in massive sums of money. They do not need to report where it comes from, so nobody knows who's leading the attack. And we simply have to reform that. I'm a firm believer in transparency. I'm a firm believer in sunlight. And I think that these 501c4s, along with the 527s, are at the root of an awful lot of the problems we have in politics. Again, I will say, if we want to, we got to take the money out of politics, and we got to get back to the days when elections were won and lost as opposed to bought and sold.
Amen.
That was our last question, so now we're going to have closing statements. Mr. Zeldin? 2 minutes.
Well, thank you again for having us. The Congressman and I are going to be seeing each other at least another 1,000 times between now and Election Day, between debates and meet the candidate nights, and it's just a great opportunity, especially getting questions from the audience. You never know what you're going to get asked next. I would just encourage anyone here, if you ever hear, read, see anything, just contact the individual campaigns. It's been an interesting year for me. I've had over $5 million spent against me in attack ads. And you know what? You have to have a thick skin. My daughters are 8 years old. They just turned 8, and I guess it was back in March. There was a mail piece that came out celebrating the anniversary of me voting for Obamacare. I'm a state senator up in Albany, and my daughters. There was one side, it was a chocolate cake, and the other side was an empty plate with chocolate crumbs. And my daughter, 7 at the time, was laughing at this mail piece, and I wasn't laughing. And I asked her what she was laughing about. And she thought it was funny that it was a birthday cake for Daddy. And then she flipped it over, and she was dying of laughter. And we asked her what was so funny, and she thought it was funny that Daddy ate her cake. Daddy ate his cake, and I'll tell you, we're 25 days out from an election. I just stopped watching TV. It's good that we are out here in the public, meeting each and every one of you. Again, the incumbent and I disagree on a lot of important things. I believe that it's good to have new leadership, new blood come in at all levels of government, and to have change. And I believe that there's a lot of dysfunction in Washington, a lot of fiscal insanity. They've passed one budget since 2007, and that we would be better served if we didn't have individuals staying there a really long time. I think Charlie Rangel's been in the House of Representatives now about 44 years. So I ask for your vote, and I look forward to meeting each and every one of you, and thank you again for taking the time on a Friday night to be here.
I also thank you for being here. I also ask for your vote, by the way. But and I also should point out that the mailer to which Lee is referring was sent by his primary opponent, not by me. This is an important election. It's an election in which I think some things are going to become clear. And one of the things for me that is really the choice is whose side is your elected representative on. Are you going to have an elected representative who's going to remember where he came from and is going to fight for the people he represents and keep his focus on individuals? Or are you going to have a representative who may have other priorities? I think you know where I stand. I think you know how I've served for the 12 years that I've been in office, and I think you know where I've put my priorities. I believe I've put my priorities in the right place. I'm focused on the middle class. I'm focused on making sure that college is accessible and affordable for our young people. I'm focused on seeing to it that seniors are able to enjoy a retirement to the greatest extent possible, free of concerns about whether they're going to have access to health care or access to adequate financial support. I feel very strongly that we have to support our nation's veterans. I know that's an area that Lee and I agree on very strongly. So I ask for your vote. I ask you to give me the opportunity to continue to provide the service and the commitment that I have provided to each and every one of you, as well as this entire district over the last 12 years. Thank you all very much.
Thank you all for coming. Remember, if you came in late, I have absentee ballot applications. If you want to register,